Well, I've heard a few podcasts of you, and I generally think that hip is an area that is really badly treated in Norway as by physios in general. So I think we really need some input from a guy like you, and we really have these days. So that's been really good.
What were the things you find difficult with those patients before?
I guess to just get a good sort of simple overview of the different conditions and the rehab, how you pick it up. Basically just, it's been a bit of a black hole, I think. Even though you have a sort of general look at it, you don't have the sort of the ability to see it really specifically.
Yeah. And obviously there's a lot of stuff we covered on the couple of days. So what are the things which stands out to you, which you thought, oh, that's great, or give you a bit of that sort of information for you?
In a way, it's hard to tell because it's been so many golden points all the weekend or all the 2 days. But it's I think it's sort of the nice overview that have a look at these 5 sort of conditions with hip problems, make it simple, and I think to really make it simple like you do, you need to know it properly. But you give us a really good overview and make it very sort of systematic, which is really nice. Great, some really nice and simple hands-on techniques which can be really powerful, and some good rehab stages where we can sort of put them in sort of stage 1, 2, 3, which is really good for both the irritable patient but also the sort of non-irritable patient. So that's been nice.
So I think going back to your clinic, when you go back next week, what are the things you think you can start applying to your patient or implement in the future?
I think the best thing is to get that sort of overview, so you don't get sort of confused when you see a hip problem. You can sort of put it into more boxes like OA, is it FIA, is it a dysplastic hip, or is it more extra-articular like soft tissue work, submuscles, that sort of thing, which has been like a really good overview.
And you feel it's given confidence to take a new set of patients to your practice?
Absolutely. I think we need to treat these patients better, and probably we'll see more of them when we do that.
Yeah, because you're attracting them more on that.
Yeah.
So a lot of international people attend my course. So anyone from Scandinavia or thinking of attending my course, and if they ask you, what would you say to them?
Well, I would highly recommend it, and we want to have you back here so we can get more skill in these sort of
areas.
Yeah.
Yeah, thanks for your time.